Alright guys, welcome to part 2 of our respiratory 2140 oxygen therapy videos. This video we are going to talk about what are called LVNs, or large volume nebulizers. The purpose of large volume nebulizers is to administer oxygen as well as humidity. And this could either be heated, so you'll hear it called a heated large volume nebulizer, an HLVN, or it could be cool, aerosol, so a CLVN. Cool large volume nebulizer. First we're going to go over the equipment, and then we'll also talk about purposes as we work on setting it up. You will need two lengths of corrugated tubing. So we have our 2 lengths of corrugated tubing. We need both an air and an oxygen flow meter. You need both. You need a thermometer to attach in, a drain bag for condensation to build up in, a large bottle of sterile water. We want to make sure it is sterile and clean, and that this helps prevent any type of infection or any type of bacteria growth in this setup. If we are doing a heated, we need a donut heater, which I'll show you guys how to use and install. A nebulizer, a large volume nebulizer. Some facilities use one called a Mistiox. That's a brand name, but they do the same thing. Plain oxygen tubing. And then whatever interface we're going to use, and I will show you the interfaces when we get there. So I think the best way to put these together is start from the wall, what you would use for the wall, and then build it out from there. So to begin with, we will have both our air and our oxygen plugged into the wall into a 50 psi, just as we always do. How I keep a track in my mind of if I need to hook my LVN up to either air or oxygen initially is the 60% rule. If I have 60% FiO2 or less, I'll put my main LVN on my air, and this will make sense in a second. If my FiO2 is 60% or greater, I will hook it up to my oxygen flow meter. So for our example today, we're going to say our patient is on less than 60% FiO2. So I will take my water, my sterile water. I already took the wrapper off so you guys didn't have to hear that. I take my nebulizer. For this purpose, I'm going to show you the heated. So with the heated, we have our donut. And what it is it plugs into the wall. All respiratory equipment gets plugged into red outlets. It's because this has a automatic backup to the generator so that there isn't any type of lag, so there's no risk of our equipment malfunctioning. It just goes straight and has a smooth electric connection. So we hook this up to the wall. And on the bottom, there's a hole. You can see the hole. You attach the bottle of water and twist it on. After that, you take the nebulizer and you stick it through that hole into the water bottle. And again, twist it on. You don't have to twist them as hard as you can, but make sure your connections are secure. On the heater, you have your on and off switch. You will know it's on if it's glowing. And then over here is our temperature gauge, so you can either turn the temperature up or turn it down. Our goal is 31 or 34 degrees if it's for non-invasive. That means if the vocal cords are above 31 to 34 degrees Celsius. If it is below the vocal cords, such as a trach or any type of advanced airway, you would want it 37 degrees or body temperature. So you control it there on this little knob. So on our nebulizer, we have a couple different attachments I want you guys to know. Up here we have another connector. Since our patient is on less than 60% FiO2, we're going to hook them up to air. And then connect to the wall. This little red piece will take off. And then we have a small port and a large port. We take the oxygen tubing, connect it to that small port, and we take our oxygen and we attach with the nipple nut adapter the oxygen tubing so that we can do what's called bleeding in oxygen. This large hole right here, we attach the corrugated tubing, one piece. With that, we then attach our thermometer, and our drain bag. This is so that if we do get any water collection, we can drain it from here. There is a port here at the bottom that we're able to open up and drain any condensation. And then this thermometer here is how you would adjust your temperature on your heater donut. The other side, this little plastic piece here on the drain bag allows it to attach to the bed or somewhere low so that the water can drain into the drain bag. And then next we attach our other corrugated tubing. This looks a little intimidating because there's a lot of pieces, but if you break it down and do it a little at a time, it gets pretty, once you set it up, it's pretty easy. So the different interfaces we can attach to the end for our patient is either an aerosol mask, and this is like a simple mask. It sits right on top of the patient's face. We attach it here, and this is how we can administer both humidity, heat, and oxygen. So we can use this to help with secretion hydration, to help with mobilizing secretions. This adapter is called a trach mask. This sits on the patient's neck over top of a trach of a spontaneously breathing patient to help keep the airways humidified and oxygenated and warm. So again, that will attach here. There is a snap, so you can unsnap it, bring it around the patient's neck, snap it again so it stays in place, and then you can adjust the elastic here. Finally, the third attachment is what's called a face tent, and this again will attach here. This is commonly used for patients that are either struggling with claustrophobia or facial trauma. We will also set this up for situations such as a patient has a pituitary surgery where there's some type of upper airway or nasal inflammation where we're worried about the swelling and we just want to give a cool aerosol to help that patient out. So it will sit underneath the patient's chin, over top their face, bring it back behind their head so that that patient can get that humidity and the oxygenation they need. So this would be an example of a heated large volume nebulizer. A cool large volume nebulizer is exactly the same. We just remove the donut. So the donut heater is not needed for a cool large volume nebulizer. So situations you would use a heated large volume nebulizer would be most commonly with trach patients that are weaning off of trachs. and just needs some humidity and some oxygen to provide to their advanced airway. CLVNs are most commonly used for patients with needing it non-invasively, so that just require a mask. So think most likely I'll set up a CLVN, a cool large volume nebulizer, for a mask or a face tent, and most commonly a heated large volume nebulizer, an HLVN, for a trach. So it simply attaches just like that. And then we attach our flow meter. Our air, because remember air is yellow. Our corrugated tubing. Down to our drain bag. With a CLVN, you don't need the temperature gauge, so we can take that out of line. And then to our patient interface. Alright, so now that we are familiar with our equipment, we will talk about our flow meters, because this is where a lot of students get a little bit stumped. And in lab, I'll draw the equation on the board. So whatever your nebulizer is attached to, we will run at 15 liters. This allows for that nebulization. So nebulization is converting a liquid to an aerosolized gas or vapor using pneumatic energy, using a pneumatic source. So that's the definition of nebulize, is, again, I'll just say it again, converting a liquid to a vapor or a vaporized gas using a pneumatic source. So in order to nebulize, you'll run this at 15 liters to get through all of this humidity and for it to reach up to the patient. This one has a little bit of a cheater sticker, but we will bleed in our FiO2 based on our oxygen. So the equation, and you can use this for nasal cannula, you can use this for any oxygen device, is we breathe 20.8, so we always say 21% FiO2 or oxygen. That's room air. That's baseline. So just to make the math a little bit easier, we do start at 20. Every liter up from there increases our FiO2 by 4%. So we can figure out how many liters we need or how much oxygen we're giving by 20. So we do 20 just to make the math easy, plus 4 times whatever our liter flow is. And I'll write this up on the board in class. So 20 plus 4 times our liter flow will give us our FiO2. And with any algebra, if you have the FiO2 but you need the liter flow, you can replace the numbers and move the numbers around. So that's just a simple shortcut. You could sit there and count 1, 2, 3, 4, or you can just do, okay, I am needing to give 4 liters of oxygen, so 4 times 4 is 16, plus 20 is, you're giving 36% FiO2 if you're running at 4 liters of oxygen into your LVN, into this adapter here, through your oxygen tubing. The only other thing I'm going to say is be conscientious of infections, and use clean technique when you're changing out the water to not let the nebulizer touch a whole bunch of stuff, and be conscientious of your heater, and then just kind of always make sure you keep your area clean and nice. It helps for patient safety, it helps for keeping the room nice, and it just, a little extra time shows you care. So that is the HLVN and the CLVN. Make sure you write down questions and bring them to class, and we'll let you guys get hands-on. This one is a little intimidating because of all the bits and pieces, but once you get your hands on, I think it'll be really beneficial for you guys. Okay, thanks so much.